None that I'm aware of. Inevitably, over the course of a mass vaccination program, at some point there will be a truck that has an engine problem, or somebody may drop a vial, and I think we need to be aware of this sort of thing. But just this morning, for example, when we had the news about the second shipment of vaccines, they were able to report that the temperature monitoring was all in place, that the safeguards that they put in place. So there'll be the normal course of human events, things which in a flu season would happen every day and which would be unremarked upon. But because of the focus on this, it's understandable. So we have probably the strongest control program that Australia has ever put in place for a health program, and we have a vaccine operations centre at the Department of Health which is overseeing this, and they're monitoring, and so far the reports have been good.
You're saying there's been about 100 flights of per week around that much. Do you have any advice on what the timetable schedule is like for us? Would you expect that it would be regular and weekly doses around that number? What do you advise?
We'll provide that detail once shipments are in country. I do apologise for this, but because of the precious nature of the cargo, because of the security around international shipping, we provide details on flights and arrivals after the fact. That's our strong security advice. But we're in a strong position, and the news from both providers and companies overnight has been heartening and strong, and we're on track for AstraZeneca to begin in early March, and that, as I say, should lead to an early doubling of doses per week for Australians, and then from late March, once the Australian-made CSL doses are produced, then that will lead to a very significant growth.